and welcome to the Master Anatomy platform. Here we choose praise or daphne, and today we'll be talking about the hand, its muscles, and their movement. First, we'll introduce the hand, then we'll talk about the muscles, and basically we'll dive into the intrinsic muscle compartment. Then we'll want to look at the muscles, the specific muscles in those compartments. Then we'll go over some clinical correlates. Let's go. See that the hand is a very important part of the upper limb. It's distal to the forearm. It's very important for performing various activities, from catching a ball to throwing it back to high-fiving your friend to saying hello to writing to playing musical instruments and so many other things. And it does this through the help of its skeleton, its muscles, and also its sensory nerve feedback. So when we talk about the hand muscles, we classify them into two, the extrinsic and the intrinsic muscles. The extrinsic muscles originate in the forearm and the arm and insert in the hand, and they are used for crude movements and forceful gripping with the hand, while the intrinsic muscles originate and insert entirely in the hand, and they are mainly used to execute fine precision movements in the fingers, like giving a thumbs up or putting your pinkies out when you want to drink a cup of tea, to playing the piano, how you move your fingers so eloquently, to playing the violin and how you put your fingers on the string, to playing the guitar, and so many other activities. Just the precise fine movements of the fingers. So today's lecture will focus mainly on the intrinsic muscles of the hand. To learn more about the extrinsic muscles, you can check the Master Anatomy platform for more information. Going on to the intrinsic muscles of the hand, we have 5 compartments for the intrinsic muscles of the hand, and we use the mnemonic HI-CAT to remember these 5 compartments. We have the hypothenar compartment and the interosseous compartment. That's for the high parts. Then for the CAT, we have the central compartment, the adductor compartment, and the thenar compartment. Looking at the diagram over here, this bluish area in the medial part of the hand is the hypothenar compartment. Lateral to this pink area here is the central compartment. Then we have this orange area here, lateral to the central compartment. This is the thenar compartment. Deep to the thenar compartment, that is underneath it, we have the purple area, that is the adductor compartment. Over here we have the reddish area. This is in between the metacarpal bones, and this is for the interosseous compartment. So we'll start with the hypothenar compartment, and the mnemonic we use to remember the muscles of the hypothenar compartment is all for one. The muscles start with the letter A, F, and O. That's the abductor digiti minimi, the flexor digiti minimi, and the opponens digiti minimi. And then they are all supplied by their nerve supply. They all have the same nerve supply. That's the deep branch of the ulnar nerve. We have this diagram over here, for better understanding. So let's start with the abductor digiti minimi. The abductor digiti minimi is medial, and it originates from the pisiform and the flexor carpi ulnaris tendon. The pisiform is a carpal bone in the hand. So we can see our flexor carpi ulnaris tendon, a muscle here, and this is its tendon, and we have our adductor digiti minimi over here. It inserts at the proximal phalanx of the little finger. It's supplied by the deep branch of the ulnar nerve, and it's used to abduct the little finger. When we say abduct the little finger, this in the sense that when we're drinking a cup of tea and we put our pinkies out, that's abducting our little finger. Next, we have the flexor digiti minimi, that is lateral to the abductor digiti minimi. It originates from the hook of hamate. The hamate is also a carpal bone in the hand, and it also originates from the flexor retinaculum. It inserts at the proximal phalanx of the little finger. Nerve supply, like we said, the D branch of the ulnar nerve, and it flexes the little finger at the metacarpophalangeal joint. You can see our flexor digiti minimi over here. And to imagine flexion of the little finger, or to understand what flexion of the little finger looks like, I want you to form the letter 3, or sorry, the number 3 with your second, third, and fourth fingers. And then what your little finger is doing right there is flexion. Then we have the opponent's digiti minimi that is deeper, and it originates also from the hook of hamate and the flexor retinaculum. It inserts at the medial aspect of the fifth metacarpal. Its nerve supply, like we said again, deep branch of the ulnar nerve, and it laterally rotates the little finger towards the palm for opposition. So basically it brings the little finger closer to the thumb. So like, try to allow your little finger touch your thumb. What you're doing right there is opposition. So they all have a common action by helping to deepen the cup of the palm for a proper grip, and they form the hypothenar eminence, that's the bulge at the medial side of the hand. Moving to the interosseous compartment, we have two sets of interossae. We have the palmar and the dorsal interossae. The palmar interossae are 3 in number, and they are unipennate, and they are located on the palmar surface of the metacarpals, while the dorsal interossae are bipennate, and they are the most dorsally located of all the muscles, so they are easy to palpate. In this diagram, we have the dorsal interossae here. So when we say unipennate, it means that the muscles are attached to their tendons in they follow their tendons in one direction, while bipennate means that they follow their tendons in 2 directions. So looking at the dorsal interossae over here, we can see that there are some muscle fibers over here and there are some muscle fibers over here, but they all have a common tendon. So that's what we mean by bipennate. So to remember their actions, we use the mnemonic dab and pad. Dab means that the dorsal interossae abduct at the metacarpophalangeal joint, and when we say abduct, it's like taking our fingers far apart and giving someone a high five. We're abducting when we take those fingers far apart, or when we're trying to form the number 5. And then when we say they adduct, the palmar interossae and adduction means that we're bringing the fingers together, and maybe we're trying to say the pledge or trying to salute at an officer. That's what adduction is. So together, the palmar and dorsal interossae help the lumbricals in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Don't worry, we'll come to that. So when we want to talk about their origin, their insertion, their nerve supply is by the D branch of the ulnar nerve. Most intrinsic muscles in the hand are supplied by the D branch of the ulnar nerve. We can see our palmar interossae over here. We can see that they all attach the tendon in one direction. They're all moving in one direction, so that's why we call them unipennate. And we see that they are 3 in number, contrary to the dorsal interossae that are 4 in number, and they are attached to the second, the fourth, and the fifth digits, not the third or the first. So we have dorsal interossae originating from the adjacent sides of 2 metacarpals. They insert at the bases of the proximal phalanx at the extensor hood of the second, third, and fourth digits. Nerve supply, the D branch of the ulnar nerve, like we said. Action, abduction at the second, third, and fourth digits. Then the palmar interossae, they originate from the palmar surfaces of the second, fourth, and fifth metacarpals. They insert at the bases of the proximal phalanges, and they also insert at the extensor hood of the second, fourth, and fifth digits. Nerve supply, D branch of the ulnar nerve. The action, adduction. So coming to the central compartment, we have a set of muscles called the lumbricals. The lumbricals are worm-like muscles. Actually, the word lumbrical is Latin for earthworm. So we have 4 lumbricals, and we can see in this diagram here that they are attached, they are associated with the second, third, fourth, and fifth digits, and not the thumb. So they originate from the flexor digitorum profundus tendons and insert on the lateral sides of the extensor expansion of the second to fifth digits. So the flexor digitorum profundus is actually a muscle in the forearm, and its tendons insert in the hand. So we can guess that it's an extrinsic muscle of the hand. So the lumbricals are divided in the sense that they are we have the lateral lumbricals and we have the medial lumbricals. The lateral lumbricals are lumbricals 1 and 2, while the medial lumbricals are lumbricals 3 and 4. The lateral lumbricals are unipennate. Like we said, the muscle fibers all follow one direction towards the tendon, and they are supplied by the median nerve. So when we want to remember this, we say that lumbricals 1 and 2 are married, in the sense that the two shall become one. That is, the fibers all follow one direction, uni 1, and M for median nerve. And we say that the medial lumbricals 3 and 4, they are bipennate, and they are supplied by the ulnar nerve. And what we use to remember this is that lumbricals 3 and 4 are united, the union of two. That's 2 for bipennate and U for ulnar nerve. So I hope that helps to remember it. Then their action, they help to hold a P and form an L. That means that we can see in this diagram here the letter L. We can see our P over here. They help to flex at the metacarpophalangeal joints and extend at the interphalangeal joints of the second to fifth digits. So coming to the adductor compartment, the adductor compartment houses just one muscle, which is the adductor pollicis muscle. The adductor pollicis muscle is large and triangular. This is our adductor pollicis over here. We can see it looks like a triangle actually. And we say that it has 2 heads and 1 insertion. So 2 heads of origin and 1 common insertion. We also say, we can say that it has 2 heads and 1 tail. To help remember this, if it helps you remember this, you can also keep that in mind. So we have the transverse head and we have the oblique head. This is the transverse head over here, this is the oblique head over here. This is the first metacarpal, the second, the third, the fourth, and the fifth metacarpal. So the transverse head originates from the third metacarpal, while the oblique head originates from the bases of the second and third metacarpal, the capitate bone, and other adjacent carpals. The insertion is at the base of the proximal phalanx of the thumb. We can see it over here. When we talk about the nerve supply, it's supplied by the ulnar nerve, like most muscles in the most intrinsic muscles in the hand. The adductor pollicis helps us to adduct our thumb. That's like putting our thumb closer to the other fingers, bringing it closer to the midline of the hand. So we know that the palmar interosseous help to adduct our other fingers. That's our second, fourth, and fifth, and our thumb is adducted by the adductor pollicis muscle. Okay, so now we're going to the thenar compartment, and the mnemonic we use to remember this is 1 for all. So the muscles start with letter O, letter F, and letter A. So first we will start with our opponens pollicis muscle. It's the largest and the deepest of the thenar compartment. They all originate from the flexor retinaculum and tubercles of the scaphoid and trapezium bones. The scaphoid and trapezium bones are carpal bones in the hand. It inserts on the lateral side of the first metacarpal of the thumb. It is supplied by the recurrent branch of the median nerve. Most muscles in the thenar compartment are supplied by the recurrent branch of the median nerve, contrary to all the other muscles that have been supplied by the deep branch of the ulnar nerve. And the opponens muscle, the opponens pollicis, medially rotates the thumb. This is what our opponens pollicis does here. And yeah, the thenar compartment muscles form help to form the thenar eminence. That's the bulge, and we can see this bulge over here. So next we have the flexor pollicis brevis. It has a superficial head and a deep head. It still has the same origin, the flexor retinaculum and the tubercles of the scaphoid and the trapezium bone. And it inserts on the lateral side of the base of the proximal phalanx of the thumb. The superficial head is supplied by the recurrent branch of the median nerve, but the deep head is different in the sense that it's supplied by the deep branch of the ulnar nerve. And how we can remember this is deep calling onto deep. So the deep head wants the deep branch of the ulnar nerve. So I hope that's not too tricky for us to remember. Then its action is to flex the thumb at the metacarpophalangeal joints. So we see it here, like when we're forming the number 4 with our fingers. This is what our thumb does, flexes. So our abductor pollicis brevis, same origin, the flexor retinaculum and the tubercles of the scaphoid and trapezium bone. The insertion is also the lateral side of the base of the proximal phalanx of the thumb. Its nerve supply, the recurrent branch of the median nerve, and it abducts the thumb at the metacarpophalangeal joint. So this is what abduction of the thumb looks like. We can, just for emphasis, this is our opponent's pollicis, is the deepest of all. These are flexor pollicis brevis, and this is our abductor pollicis brevis that has been cut this way for us to see the opponent's pollicis better. Okay, so we've talked about the compartment, but lest we forget, there is a surprise muscle outside this compartment that we call the palmaris brevis. Let's remember that PB, palmaris brevis. It's a small, thin, contractile muscle in the subcutaneous tissue of the hand. You can see the palmaris brevis over here. So the palmaris brevis is not in any of the compartments that we've mentioned before, but it also helps in the hand movement, and it's an intrinsic muscle too. So it overlies the hypothenar muscles and other structures in the palm, and it originates from the palmar aponeurosis over here and the flexor retinaculum, and it inserts in the dermis of the skin. You can see the skin here, and so it inserts there. It's supplied by the ulnar nerve, but this time it's not the deep branch of the ulnar nerve, it's supplied by the superficial branch, because remember we said deep calling onto deep. So since it's a superficial muscle, it will be supplied by the superficial branch of the ulnar nerve. So its action is to improve the grip by deepening the cup of the palm. And to remember our palmaris brevis muscle, so it won't be left out when we're mentioning the intrinsic muscles of the hand, we can also use PB to remember this. PB for prison break. So palmaris brevis is making the prison break out of the other compartments, and it's subcutaneous. So now that we've gone over the intrinsic muscles of the hand, we're going to take a look at some clinical correlates. First on our list is the paralysis of the interossei and the lumbricals. So remember when we said that the lumbricals are for flexion at the metacarpophalangeal joints and extension at the interphalangeal joints, yes, to hold the P, and we said that the interossei assist them. So when these muscles are paralyzed, we have hyperextension at the metacarpophalangeal joints and hyperflexion at the interphalangeal joints of the fingers. We can see this here in this diagram. Next is the simian hand deformity, and it's caused by injuries to the recurrent branch of the median nerve. We should remember that the recurrent branch of the median nerve is the major nerve supply to the muscles in the thenar compartment. So injuries like wrist slashing or laceration of the thenar eminence could injure this nerve, and it could limit the thumb movements to just flexion and extension. So the thumb will not have the ability to oppose, and there will be limited adduction of the thumb, and also there will be emaciation of the thenar eminence because the muscles aren't doing as much work as they should do, and so there will be atrophy, and so the thenar eminence won't have that usual bulge that it should have. So next on our list is dupuytren's contracture.
We should note that it's contracture and not contraction. A contracture is a permanent shortening of a muscle or a fibrous tissue, and it prevents the normal movement of that particular body part, while the contraction is a temporary shortening. And so the preterm contracture is frequently bilateral, meaning that it affects both hands, and it's a disease of the palmar fascia and the aponeurosis. The palmar fascia and aponeurosis is basically the deep fascia that covers the palm, and it helps to protect it and protect the muscles and structures inside. And so this disease is seen mainly in men greater than the age of 50 years, and its cause is unknown, but evidence points to a hereditary predisposition. So what happens is that at first there is a painless nodular thickening in the palmar aponeurosis, and this nodular thickening adheres to the skin. We can see over here that the nodular thickenings here, and they are initially painless and they are adherent to the skin, and they continue thickening and shortening and thickening and shortening, and this affects the fourth and the fifth fingers. And so because of the thickening and the shortening of the palmar fascia and aponeurosis in this area, we see that there is now flexion, partial flexion at the metacarpophalangeal joint and the proximal interphalangeal joints, and as a result it complicates the hand movements because it doesn't allow the fourth and the fifth fingers to do as many movements as they should, and so some hand movements are quite difficult for these particular individuals. And usually the treatment involves a surgical excision of the fibrotic parts to free the fingers to be able to carry out those movements that have been impeded.
This is for our bike riders out there. Ever heard of handlebar neuropathy? Well, handlebar neuropathy is common in people that ride long distances on bicycles. They tend to put their hand in an extended position against the hand grips of the bicycle, and this causes compression of the ulnar nerve. Remember that the ulnar nerve supplies a lot of intrinsic muscles in the hand. It also gives a sensory innervation to the medial side of the hand, that's the pinky and the ring finger area. So when the ulnar nerve is compressed, there is a sensory loss at that medial side, and there is weakening of the intrinsic muscles. However, this condition is self-limiting and in most cases doesn't need medical intervention. But we could prevent this by having the proper bike size, by having the proper posture, by changing our position from time to time while riding on the bicycle, and also hand exercises could be done.
Okay guys, let's remember that our intrinsic muscles are for fine movements of the fingers. The intrinsic muscle compartments, we can use the mnemonic HICAT to remember it. We can remember our prison break muscle, our palmaris brevis. Let's not forget that our lumbricals 1 and 2 are married, 3 and 4 are united. M for median nerve, U for ulnar nerve. Let's not forget our lumbricals help to form an L and hold a P. That's flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. You must not forget our DAB and our PAD. Dorsal interosseous for abduction and palmar interosseous for adduction. Our adductor pollicis has what? 2 heads, that's the transverse and the oblique, and 1 tail, that is 1 insertion. And where is that? Yes, the base of the proximal phalanx of the thumb. We also must not forget that our intrinsic muscles, all of them are supplied by the deep branch of the ulnar nerve except the loaf muscles, which are the 2 lateral lumbricals, the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. That's the superficial head. You must remember that the deep head is supplied by the deep branch of the ulnar nerve, that is deep calling onto deep. Well done guys, we've come to the end of today's lecture. Thank you for listening. I hope you've learned a lot. To test your knowledge, you can check out our quiz on the intrinsic muscles of the hand. If you have any questions, feel free to message us, contact us, email us. If you've enjoyed this lecture, please like our page and subscribe to our YouTube channel for more videos. Thank you. So these are my references in case you want to go further and get to know more about this topic and other topics too. Thank you.